So we've got a child abuse scenario very quickly as well. I'll read it out loud. Max, a 7-year-old boy, comes in for a routine checkup with his mum. On your way to examining him, you notice some deep colored bruises on his upper chest and arm. What is your next step as a dentist? So firstly, just so we can get through this part quite quickly, you'd want to highlight the key elements of the case. So, and this is something that you should get into the habit of doing, especially when it comes to interviews. When you're reading a scenario, pick out the key elements and the facts. So what are the facts of the case? You've got Max, who's a child, he's 7 years old. Routine checkup means that you could infer that he's a regular attendee. You can also question that to the interviewer whether or not Max is a regular attendee with his mum. And then on your way to examining him, you notice bruises. So they're the facts of the case. And what you're asked is what you want to do next. So now that you've sort of understood the facts of the case, what you need to do is unpick it and think about what is the next option. So Max is a child, so you'd want to be talking about competency and informed consent. Typically, Max is not old enough to make his own decisions and old enough to consent treatment. That's why his mum is there. But as we mentioned before, if someone is competent enough and understands what's happening to them, they can be in a position where they can give consent. You won't only have competency issues with a child, but also communication barriers with Max himself. Being a child, it's very hard to discuss treatments, complicated and complex treatments. I mean, as a student myself, I have trouble talking to adults about treatments. So you can only imagine how hard it could be talking to a child. So that's definitely something you'd want to consider when it comes to your next step, is how well can you communicate with Max about what you see. So like, if you were to ask Max about the bruises, would he tell you? And if what he tells you is truthful, if it's correct, you need to sort of consider that. And then you'd also want to assess and communicate. So if you want to pop into the next slide, I've got this written out. So you also want to assess and communicate. So can you take, okay, sorry, it says Jake, but can you talk to Max without the mom present in the room? And this is something that I would do personally. I would try and get my nurse or someone to just sort of get the mom out of the room, if I can, and just ask Jake, like, how his day's going, sorry, Max, how his day's going, and sort of get more information about that rather than jumping the gun and saying what happened to you and why the bruises on you, just because you can never really jump to conclusions as a dentist. On the off chance that it's incorrect, it will look very badly on you and the practice, and it will break the trust that you've built with your patient. But once you assess and communicate, you can also communicate with your team and assess how you would want to move forward, and then eventually decide what to do. So if now's the best time to act, if not now, later, depending on the best interests of the patients, you want to consider all avenues of ethics. So autonomy, beneficence, everything. Make sure that if you don't act now, that your patient will not be in harm, or you don't think your patient will be in harm. Otherwise, it's best to act now. And if you don't act now, make sure that you put it in your notes, and you make sure that you come back to it. So in an interview, I would definitely try and think out loud and talk about all of this. And then if you were ever sort of pushed towards a decision, I would say it's very good to, in this case, consider everything, assess and communicate, see what your team says, and act now if you feel like everyone in your team agrees with you. If not, then definitely act at a later time, but make sure that you take note of it. So that's ethics done.
That's it.
So should we talk about the different options and then do Q&A very quickly?
Yeah.